Wanted to just say a few notes of thank you to the whole team at Weill Cornell and the Future of Care for putting this conference together, and certainly including EDC. Also to Rockefeller University for hosting, and to my team at EDC, including Miko Belosis, who's joined here today, who put a lot of work into this speech today. So as Shannon mentioned, my name is Doug Thiede, and I'm the Senior Vice President of Life Sciences and Healthcare at EDC. EDC is the organization for driving and shaping economic growth throughout the 5 boroughs. I'm going to talk a little bit today about some things around healthcare and healthcare innovation. You'll hear from other innovators today. But EDC, just to give background for those who don't know, we do some pretty amazing projects that you may know throughout the city. I won't touch on all of them, but one that's probably very well known within the room, EDC was responsible for the Cornell Tech project in Roosevelt Island. We've also recently launched last year the New York City ferry system. A few weeks ago, we launched a cybersecurity, Cyber NYC program, a $30 million investment to be the future of growth in cybersecurity, and also the mayor's initiative of the $500 million Life Sci NYC initiative to help life science growth here. That gives you an idea of some of the scale of investments that we make, but today we're going to talk more about targeted investments really to help New York City's healthcare ecosystem and programs to support our flourishing digital health companies grow even stronger. And right now, the digital health economy in the world, and certainly New York City, is booming. New York City is currently the second most active metro area for digital health investment, just behind San Francisco. With $2.3 billion in investment and 71 deals in the first 3 quarters of 2018 alone, New York City has had nearly twice as many deals and twice as much funding as Boston, the 3rd most active area. Over the past 7 years, venture capital funding for New York City-based companies has increased tenfold. From being here since 2009 and living on the West Coast, I think it's pretty extraordinary the growth that has happened here in New York City. It's something that I think it should not be lost on anybody here from both the clinician side as well as the innovators. On top of the significant investments that New York City has, we've got a great health ecosystem here. We've got incredible health systems and providers that are noted here. Industry leaders are realizing that New York City is becoming the best place to start and grow a digital health business. These strong health systems and providers can lead health tech companies like Flatiron, ZocDoc, and Oscar, who recognize that there's a rich tool of talent and one of the largest and most diverse patient populations in the country. The success of our ecosystem as a whole is largely due to the city's competitive advantages. Simply put, no other city can offer what New York City can. Roughly 2.3 million New Yorkers have a bachelor's degree or above. That's more than Los Angeles, San Francisco, Philadelphia, Washington, and Boston combined. This deep talent pool makes it easy for founders to staff growing companies, whether it's on the engineering side, the business side, all different elements. We've got an incredible talent base. In addition, New York City is home to 3.3 million immigrants from over 150 countries. We have more workers with H-1B visas than anywhere else in the world. These New Yorkers provide companies with global perspectives, which is important in an increasingly interconnected world. And our patient populations who come from every continent to get the great premier care that was mentioned in the 4 corners and elsewhere throughout the hospital systems. It's EDC's job to capitalize on these strengths and create targeted investments to propel New York City even farther into the future. And that's what we're doing today. I'm going to talk through just a few examples of some EDC initiatives that are trying to really increase healthcare access and transform the delivery of care. First, our community health center expansion program is working to increase primary care access for thousands of New Yorkers who live in medically underserved areas. When we first launched this program a few years ago, close to 1.5 million New Yorkers reported not receiving medical care, and roughly 30% of New York zip codes were considered medically underserved areas. To combat this, EDC has provided grant funding for federally qualified health centers to expand in these city neighborhoods. To date, we've supported the opening and expansion of 7 health centers, and through the initiative, we anticipate to expand healthcare access for up to 75,000 patients a year. Our Digital Health Breakthrough Network is helping early-stage startups test and gain feedback on their prototypes with both providers and patients. The feedback's invaluable to pre-Series A health tech startups. After hearing reactions from users, founders can improve their product design, prepare for future clinical installations, and start raising capital. To date, we've supported 16 companies, including Joyce Labs, an artificial intelligence platform that helps physicians predict how specific medications will perform in individual patients, and True Circle, an app that helps connect people in underserved communities with mental health resources that are accessible, affordable, and culturally competent. We're excited that the first 8 companies through these cohorts have supported over 40 jobs and raised $2.5 million in funding. We look forward to watching these numbers increase and seeing these young companies continue to grow and change the delivery of healthcare. And last but not least, our digital health marketplace is connecting growth stage startups with buyers to foster smart commercial partnerships. Since the program started in 2013, we've had over 900 matches with prospective clients, including Northwell, Montefiore, Weill Cornell, NYU Langone, and Mount Sinai. This curated matchmaking has led to over 19,000 patients engaged in pilots and $2.6 million in grants funded to help fuel those pilots and advance care. But despite the strength of our healthcare system and its promising future, there's still serious work to do. Today, New York City's healthcare access gap is widening, and the city's stark health disparities across socioeconomic and racial lines. Too often, low-income New Yorkers and New Yorkers of color don't have access to the services they need to stay healthy. The statistics are jarring. And what you're seeing here is a poverty map where you've got percentage of population below the poverty line. I'm going to talk through just a couple different neighborhoods that really show and highlight that equity problem. Today, 44% of Bronx residents in Crotona and Morrisania live in poverty, which is known to be one of the most powerful predictors of poor health. And just 8 miles away, here in the Upper East Side, only 7% of residents live in poverty. It's no coincidence that 92% of residents on the Upper East Side self-reported that they're in excellent and good health, while only 67% of Crotona and Morrisania patients said the same. Some of these Bronx neighborhoods also have some of the highest rates of diabetes and lowest life expectancy in the city. We know that low-income communities like these can highlight preterm birth defects, obesity, stroke rates, and are all higher in their wealthier counterparts. But we can't be a city where the zip code where you were born determines how long you will live. On top of this, small primary care facilities that serve low-income communities, arguably the healthcare institutions that need innovation the most, are often the last to adopt technologies that improve patient care. Compared to mammoth health institutions, the facilities often seem like small fish and aren't targeted by innovators. They also have fewer resources to spend on technology and don't have dedicated innovation arms, the way large health systems do. This makes spending time to source and work with technologies a much larger lift. Without action, the digital health divide and the city's health disparities will grow even further. EDC is now helping to ensure the community facilities are not left behind in the tech revolution, and that they too can benefit from technology that improves patient care and operational efficiency. So what does this look like in practice? Through our digital health marketplace program, we've been able to help innovators bring technologies to underserved markets and by matching them with community providers. And if you heard a chuckle in the audience, one of our audience members is actually in this picture and has gone through the digital health marketplace. So if you want to learn more about it, I think you can see some firsthand experience. One great example of this is the pilot we facilitated between RubiconMD, an e-consult platform, and Callan Lord, a comprehensive primary care center serving the LGBT community, to increase the efficiency of Callan Lord's primary care appointments. Many of Callan Lord's patients are both medically underserved and vulnerable, and visiting specialists can present a formidable challenge. Studies have shown that 40% of specialists' visits are avoidable, and 1 in 5 referrals result in unnecessary or duplicate testing. E-consults through RubiconMD are a great solution to this. Primary care physician submits a patient case through an online platform, and specialist responds with his or her opinion just hours later. This allows primary care physicians to make more informed decisions on care plans, and in many cases be resolved without additional appointments. I know I'm coming up on time. I've got a few more slides. So the reason we want to bring this up is just talking through, we saw some pretty powerful results showing the platform's efficacy. You can see here, 23%, going through this, 23% of consults avoided a referral, and 33% of e-consults avoided unnecessary diagnostic procedures. RubiconMD is now raised $13 million in its Series B. They're continuing to expand in programs like this, and it's multiplying the impact in the underserved population. We also facilitated a pilot between Klara and Betances, a health center that has locations both in the Lower East Side and Bushwick, serving low-income populations. The problem here was patients had trouble connecting with their doctors and healthcare providers. Staff would spend countless hours trying to communicate with patients, questions ranging from refilling a prescription to conforming in a follow-up appointment. They may not have something like the Weill Cornell Connect system or Epic records that they can go to, and we facilitated a pilot in 2017 between Klara and Betances that gave them $25,000 to help figure out this program. And like RubiconMD and Callan Lord, we saw real results. Klara's platform saved Betances patients and office staff crucial work hours, and they're now in talks to a formalized agreement. Klara, which has raised $11 million in Series A funding, continues to grow. They've recently hired 14 employees and have thousands of practices using this platform. Patients at Callan Lord and Betances have benefited tremendously from incorporating technology into their healthcare, and there are hundreds of thousands more patients across New York City who rely on clinics that are decades behind digitally, and this adversely impacts their care. So to wrap up, we need stakeholders from elected officials and healthcare professionals to entrepreneurs to close this digital health divide. Technology is no longer an option in healthcare, it's critical. And every patient, whether they're in a world-renowned medical facility or a small neighborhood doctor's office, deserves the same level of care. So to all the medical students and clinicians in the room, I urge you to consider taking your practice into communities that need it the most and work to incorporate the most up-to-date technology to improve your patients' care. To all the innovators and aspiring innovators in the room, I urge you to engage communities that are too often overlooked by entrepreneurs. Women, low-income communities, communities of color, all need technology tailored to their care. You can be the one to help them. And to all the investors in the room, I urge you to invest in real solutions that will all but certainly improve patient care in the populations that need it the most. It's easy to invest in products that serve the wealthiest and well-insured, but this demographic is also statistically the healthiest. You can provide the resources to reach people who need disruption the most. If we take these mandates seriously, together we can close the digital health divide, and in turn, patient outcomes will be better, and New York City will be a healthier place for all. With that, thank you for having me, thank you for having us, and I think I'm turning it over to Sarita for other sessions.
Future of Care is New York City's premier community for healthcare innovation. To learn more, subscribe to our channel and visit our website at futureofcare.nyc.